Today we will be discussing about the NHS. The NHS has been around for more than 70 years of operation. Now, due to the coronavirus pandemic, its importance only seems to become more and more prevalent as we head deeper into 2021. Therefore, we decided that we would dedicate this entire video to talk about the NHS.
The history of the NHS. In 1945, the end of the Second World War, the whole country was in a state of ruin. 3 years later, Health Minister N.U.M. Bevan decided that something must change, and with a budget of £437 million, which is equivalent to £16.01 billion now, the NHS was launched.
How the NHS was founded. Before the creation of the NHS, when someone found themselves needing a doctor or medical facilities, patients were expected to pay for their treatments. In some cases, local authorities ran hospitals for ratepayers. These hospitals followed an approach called poor law, which is an approach to reduce the cost of looking after the poor. However, this all started to change in 1929. The Local Government Act led to local authorities running services to provide medical treatments for everyone. By 1930, the London County Council took over the responsibility for around 140 hospitals, medical schools, and other institutions. Once World War II broke out, the London Council was running the largest public service of its kind for healthcare. Furthermore, in 1937, a highly controversial novel called The Citadel by Dr. A.J. Cronin was published. Its controversy was due to the novel's criticism of the failure of the healthcare. As a result, the book prompted new ideas about medicine and ethics, inspiring to some extent the NHS and the ideas behind it. After these two events, there was a growing consensus that the current system of health insurance should be extended to include dependents of wage earners and that voluntary hospitals should be integrated. However, these discussions stopped when World War II started. In 1941, during World War II, the Ministry of Health was in the process of agreeing to a post-war health policy with the aim that services would be available to the entire general public. His decisions here might have been influenced by the new ideas of medicine and ethics that came around as a result of sources like the Citadel. By 1944, the Minister of Health, Henry Willink, set out the guidelines for the NHS. He included how the NHS would be funded from general taxation and not the national insurance, as well as the ideas that everyone was entitled to treatment, including visitors to the country, and that would be provided free at the point of delivery. As a result, when Aneurin Bevan became the next health minister, he took these ideas from the previous health ministers and launched the NHS in 1948.
Key milestones for the NHS and the scientific community. In 1948, the first NHS patient was 13-year-old Sylvia Diggory at Stratford General Hospital. In 1952, even though the NHS was expected to be free and financed completely through the taxation of the citizens, the spending on the NHS had exceeded the expectations of the Parliament and the Treasury. As a result, the NHS had charges of 1 shilling, which is 5p for prescriptions, and a flat rate of £1 for ordinary dental treatment. In 1954, the link between smoking and cancer was established. In the 1940s, there was an alarming rise in lung cancer. Therefore, British scientist Sir Richard Dole began research into lung cancer. His research revealed that smokers were far more likely to die of lung cancer than non-smokers. The government accepted this link between smoking and lung cancer in 1954. In 1958, there was the first mass vaccination program where everyone under the age of 15 were vaccinated against polio and diphtheria. NHS mobile immunisation vans were used throughout the whole country to carry out this huge task in vaccinating the children of the country. In 1961, the contraceptive pill became available, thanks to its developer, Professor Gregory Pincus. In 1962, the first full hip replacement in the UK was carried out by Professor Sir John Charnley. In 1968, the first heart transplant in the UK was done by surgeon Donald Ross, who led a team of 18 doctors and nurses to operate on 45-year-old Frederick West in a 7-hour procedure. In 1978, the world's first test tube baby was born. She was born through a new technique which included fertilizing an egg outside a woman's body before replacing it in the womb. This technique was developed by Dr. Patrick Steptoe, a gynecologist at the Oldham General Hospital, and Dr. Robert Edwards, a physiologist at the University of Cambridge. Leslie Brown was the woman who gave birth to the world's first test tube baby, who was Louise Brown. There were also many other milestones, but we won't go through them in this episode.
Principles of the NHS. The original 3 principles of the NHS. The NHS was launched by the Health Minister Aneurin Bevan in 1948. It was originally founded on 3 core principles. Firstly, meet the health needs of everyone. Secondly, free at the point of delivery. And finally, based on clinical need, not the ability to pay. The first core principle, meet the health needs of everyone, allowed everyone to get help with any health problems they had. This means that people with different health problems could still access healthcare through the same system. However, at this time, this mainly applied to people with physical health problems until 1959, where the Mental Health Act comes in. The second core principle, free at the point of delivery, refers to how the NHS must be free for people to enter and to access healthcare. This allowed citizens to see healthcare professionals and doctors for free, while being directed to other services if needed. Third and final core principle, based on clinical need, not ability to pay, allowed people to accessing the NHS to get all the care they needed for their health problems. Due to the wide variety of health problems as well as requirements, the amount of money spent on a patient's care was extremely varied. This principle meant that the cost of the patient's care compared to other patients doesn't affect the care they receive. Instead, the care is completely based on the needs of the patient. This also meant that people with similar health problems would get similar levels of care, promoting equality.
The current 7 principles of the NHS. Now, there are 7 underlying principles that form the part of the NHS constitution. Number 1, the NHS provides a comprehensive service available to all. Number 2, access to the NHS services is based on clinical need, not an individual's ability to pay. Number 3, the NHS aspires to be the highest standards of excellence and professionalism. Number 4, the patient will be at the heart of everything the NHS does. Number 5, the NHS works across organisational boundaries. Number 6, the NHS is committed to providing the best value for taxpayers' money. And last but not least, number 7, the NHS is accountable to the public, communities, and patients that it serves.
The 6 key values of the NHS. 1. Working together for patients. 2. Respect and dignity. 3. Commitment to quality of care. 4. Compassion. 5. Improving lives. And finally, 6. Everyone counts.
How is the NHS organised? The NHS is organised into 3 types of care: primary, secondary, and tertiary. Primary care is community-based care for patients to make their first approach to health services regarding a health problem. Examples of primary care services are GP surgeries, drop-in clinics, dentists, opticians, and so on. 90% of the meetings with patients occur in primary care, yet only 7% of the NHS budget is spent on it. Secondary care is a high-level care in a centre with multiple specialist staff and resources, such as a hospital. Secondary care services cannot normally be accessed without referral from a primary care or through emergency admission. Secondary care takes up around 70% of the NHS budget. Tertiary care is a very high level of care provided at a specialist centre that normally focuses on only one discipline. For example, hospices or neuro rehabilitation centres. Normally, for patients to access these services, they need referral from primary or secondary care.
So, now is time for a debate. This episode will be debating on whether the NHS should become privatised.
So, Tharon, I believe personally that the NHS should be privatised, and there are quite a few reasons for this. Let's have a look at Germany, Switzerland, and Liechtenstein. These are all developed countries which also all have a privatised healthcare system. And if we look at their HDI index as well as their mortality rates, they are relatively low. So this tells us that privatised healthcare systems can be effective. But if we look more closely, there are quite a few factors which improve the efficiency of privatised healthcare compared to government hospitals. For example, doctors and nurses have a very good pay, often better than in government hospitals. And therefore, there is more motivation, meaning that the workforce is more productive, and so care is often of a better quality for the patients who receive it.
Well, Aaron, I understand your points, but I, for one, I am completely and thoroughly against the idea of the NHS becoming privatised. If someone was to ask me why I was proud of being in the UK, the first thing that would spring to mind would be the NHS. The NHS embodies a national spirit and beautiful ideal that everyone should be delivered free care regardless of their wealth or status. But if the NHS should become privatised, this very core ideal would be broken. Just thinking of this from an ethical standpoint, it is much better if a service could be provided for everyone equally rather than a privatised system where some people will get treated better than others, which is completely unfair to others.
Well, Tharon, you bring up some good points here, but isn't the patient's well-being at the centre of healthcare? Patients have to spend less time in privatised healthcare as doctors and nurses are more efficient, as I already mentioned. But in addition, the quality of care that they receive is of a much higher standard compared to government hospitals, since the medicines and the technology available is often much better. As a result, they are often cured or treated much more quickly, but of a much better standard. And so their experience in private healthcare tends to be better.
While I understand the statement, I believe that is partly inaccurate. As evidence of this, a study was conducted in 2012 by a US and Bolivian team. This intensive study indicated that a public service, such as the NHS, was actually more efficient for patients. Also, Stephen Hawking gave a talk to the Royal Society of Medicine, and he also came to the same conclusion. And he has been using the NHS for the majority of his life due to his disease. If this isn't evidence, I'm not sure what is.
Thanks, Baron, for your points. And that concludes this week's debate. If you guys have any opinions that you would like to share, please do so in the comment section below. The NHS has been operating for over 70 years. However, as time goes on, the NHS seems to only become more and more underfunded as resources get stretched thinner and thinner. Therefore, I would like to leave you all with a quote from Aneurin Bevan, the founder of the NHS. The NHS will last as long as there are folk left with faith to fight for it. As the NHS seems to head further and further towards its ruin, this quote has never seemed so important.
Thank you for watching. Make sure to like, comment, and subscribe, as we will be posting more videos in the future. We also have an Instagram and Twitter page, so make sure to follow them, and we will be posting content there in the future as well. The links are in the description. And again, thank you.